So that is false. Remember, hand hygiene, keeping our hands clean, whether it's through hand washing or using hand sanitizer, is the single most important thing we can do to reduce the transmission and break the cycle of infection. Masks are important, but they're more important for, someone who is coughing. Keeping your hands clean is basically important for everyone. Pneumonia or a lung infection is one of the most common infections in the elderly. So I mentioned three things in the beginning, the three most common causes of infection in the elderly. And in this statement, I'm saying lung infections are one of those three. Is that true or false? So it is true, and that brings us on to the next topic. What are the most common causes of infections in the elderly population? So remember, pneumonia, lung infections is the one, urinary tract infections is two, cellulitis or skin infection is a third. These are three top causes of infections in the elderly. So the seasonal flu or the common flu, influenza causes acute respiratory illness and therefore is a very common cause of coughing during the winter season. Its transmission happens from direct person-to-person contact. Therefore, infected person coughs or sneezes or talks to other person, and the other person is right next to them and inhales that secretion. The incubation period is basically another way of saying when someone first inhales that cough, how long does it take for them to develop symptoms? And basically that takes 1 to 4 days, or about 2 days average, when you get exposed to someone that has the common flu or seasonal influenza. And so what are some of the signs and symptoms of the common flu or influenza? So you're going to have an abrupt onset. It's going to happen very quickly of a fever, which usually ranges from 100 to 104. A non-productive cough, meaning you cough but you don't produce any mucus. Myalgia, another way of saying you have body aches. You have quick symptoms of these three things. You can also have other symptoms such as sore throat, nausea, stuffy nose, nasal congestion, or headache. But these are they're common for basically every viral illness and not very specific to the seasonal flu. So what about the older adults and the immunosuppressed? So they're not likely going to have the same symptoms that I just mentioned. Remember, they have a weaker immune system, and usually those symptoms like a fever or a body ache are our bodies telling us that we are sick. And so if they have a weaker immune system, their bodies are not going to be telling them that. Instead, they may only present with symptoms of like weakness and just not feeling right. That's what malaise means. Older adults also have a higher tendency to have an altered mental status, where the way they're thinking and the way they're seeing things changes, which is pretty significant. Elderly people are more susceptible to complications of the flu. Pneumonia or a lung infection, basically, it not only affects the upper airway, but starts to affect their lungs. They would have cough, not only a cough, but shortness of breath, and they start to breathe faster. And it is very possible that a underlying bacteria can grow after someone first gets the virus, the seasonal influenza. It is important, therefore, for our us as workers and also basically the general population and the elderly populations to get their yearly flu vaccines, as it is estimated that majority of flu deaths happen in the elderly people. So if we can get the flu shot, not the nasal spray vaccine, to our elderly population, we can prevent that complication of pneumonia and therefore death. Now, of course, because we are non-medical, we cannot give the vaccines to the elderly population ourselves, but we can encourage them to go to their local pharmacy and do that. So, true or false question. The influenza or the common flu, seasonal flu outbreak is very common to happen during the summertime. True or false? So this is false. Remember what I just talked about, that cough, fever, body aches, that influenza virus that happens usually happens every winter time, not the summertime. So older adults with the flu can present with symptoms of just having weakness. No cough, no fever, weakness only. True or false? So it is true. Remember, older adults have a weaker immune system, and therefore their body may not be telling them that they're sick the same way that the general population is. So they can present with symptoms of weakness only. So the best way to prevent complications such as pneumonia from the flu is to get vaccinated. True or false? So this is true. Remember, vaccinations basically prevent severity of symptoms. They may not always stop a person from getting infected, but they will prevent the severity of it happening. As I mentioned, one of the common complications of the seasonal flu or influenza is developing a bacteria on top of the virus, which can cause a pneumonia, which is very serious. So it is very important for the general population and the elderly population to get vaccinated. So when I said, having a underlying bacterial pneumonia on top of your viral influenza, what was I talking about? I was talking about this bug, Streptococcus pneumonia, and it's one of the most common causes of bacterial community-acquired pneumonia. Some of the risk factors include older adults, if you're living in crowded situations, cigarette smoking, and again, influenza or the common flu is a common predisposing factor. And it is spread via human to human close contact. And this over here, we just see how this lung is completely clear, but this one is a little bit more cloudy. That's what's telling us that it's not just the upper airway that's involved. Now it's the actual lung. So remember, lung infections are very one of the top most common causes of infections in the elderly. So what are some of the classic symptoms of someone that has an infection in the lungs? Most commonly from Streptococcus pneumonia. So they have a quick onset of fever and chills, very similar to the flu. They have a cough as well. But here's one of the differences. They also have pain with deep breaths. And when they cough, it's not just a dry cough, but there's also rusty colored or even bloody sputum. And another note, there is a vaccination it is a bacterial infection, but there is a pneumococcal vaccination available for those who are 65 years and older. Again, I want to emphasize we cannot give this vaccination, but we can encourage or let people know that it is available to get at their pharmacy or speak with their physician about it. So, pneumococcal pneumonia, the bacteria that we just talked about, is spread via human to human contact. True or false? So it is true. Pain with deep breaths is one symptom of pneumococcal pneumonia. True or false? It is true. And there's currently not a vaccine for pneumococcal pneumonia. True or false? False. Remember, there is a vaccine for those who are 65 years and older for pneumococcal pneumonia. So we're still talking about lung infections here. We talked about the common flu. We talked about pneumococcal pneumonia. Now something a little bit more relevant today's times, COVID-19. So it's a lung infection, of course. Symptoms can be very mild. They may not even know they have it, to having very severe respiratory distress. The incubation period for once they first get infected with someone exposed to it is usually within 2 weeks following exposure. So the initial symptoms can be cough, body aches, a headache. They can also have diarrhea, sore throat, or any smell or taste abnormalities where they don't feel like they're smelling or tasting things like normally. So elderly people are much more likely to have severe symptoms, such as when pneumonia is involved. As we can see, both lungs are involved. This is how COVID-19 is different than the previous bug. And so it's very concerning symptoms when you see a fever, cough, and shortness of breath. Symptoms may progress over a week to become even more severe. So it doesn't have to happen right away. Some of the complications are acute respiratory distress syndrome, where they have to get on a ventilator or even developing blood clots. Remember, there's a COVID vaccine, and that's obviously provides best protection. So coronavirus, true or false, may take up to 2 weeks for symptoms to show after being exposed to someone. So that's true. Remember, you don't start showing symptoms right after you get exposed to someone with COVID. Loss of taste and smell are some of the symptoms included within COVID-19. True or false? So that is true. Those are some of the symptoms. Severe symptoms of COVID-19 start immediately in the beginning. True or false? So this is false. So remember, I said it may take weeks for the severity of symptoms to start. So it's very important to be extra vigilant. So we talked about pneumonia, lung infections. The next thing is going to be urinary tract infections. So some of the bugs, like our E. coli, enterococci, staphylococci. UTI is a very broad definition. It can be bacterial infection in the bladder or the kidneys. Some of the risk factors, so females have a greater risk of getting it than males because they have a shorter urinary tract, and this is regardless of age. Older females that are postmenopausal, estrogen is usually protective. As you get older, you lose it, and therefore postmenopausal are increased risk. Older males, remember I mentioned urinary retention or urinary continence is a risk factor for UTI, and therefore older males are at risk. Previous history of a UTI is one of a significant risk factor. If you had it in the past, you're likely going to get it again. So cystitis, which is under UTI, infection within the bladder. Some of the symptoms that people have are a strong or persistent urge to go to the bathroom, a burning sensation when urinating, frequent but small amounts of urine get produced, if there's blood in the urine, or if the passing's cloudy or strong smelling urine, or if they have any discomfort in the pelvic area, or even feeling a pressure in the lower stomach, that can also be a symptom. And even having a low-grade fever can be a symptom of infection in the bladder. Pyelonephritis is when you have infection up here in the kidneys. That's still a urinary tract infection. So you still have frequent painful urination, but this time the fever and chills are much more prominent than cystitis. You have pain in your back, side, or groin, so now you're starting to feel pain outside of your lower region. Nausea and vomiting, so systemic symptoms. And again, the urine could be cloudy, dark, bloody, or foul smelling. So some of the useful things that we can do to help prevent urinary tract infection in elderly adults. We can encourage them to drink plenty of water. Cranberry juice is thought to change the pH of urine and therefore prevent bacteria from growing. Careful cleaning. It's very important to wipe from front to back after you use the bathroom, not back to front. Check adult diapers every 2 hours. You don't want urine sitting around. And urinate as soon as you have the feeling of urine. You don't want, the elderly should not be waiting around. Avoid caffeine and alcohol. These two things can promote going to the restroom and therefore creating urine and therefore increasing risk of a urinary tract infection. Avoid douches or other irritants. So any personal products in the lower region can cause irritation and cause an entry for infection. So true or false? Drinking orange juice regularly may help prevent urinary tract infections. So this is false. Remember, it's drinking cranberry juice, not orange juice. Good bathroom hygiene can help prevent a urinary tract infection. True or false? This is true. Remember, you want to wipe from front to back, and this is especially true for females. Cloudy, smelly, and bloody urine is indicative of a urinary tract infection. True or false? This is true. Okay, now that we talked about lung infections, we talked about urinary tract infections, and now let's talk about skin infections, the third and the last common cause of infections in the elderly. So the common bacteria are group A strep or strep pyogenes, and they spread through the skin to deeper tissues. So some of the risk factors of cellulitis in seniors: if they have any cuts, wounds, or abrasions, scraping of the skin, insect bites that creates an opening, burns or ulcers, dry and flaky patches, so skin becomes naturally drier and therefore the dryness can create openings within the skin. Swelling, so basically if they have like heart disease or any poor circulation in their legs, that swelling can create an opening for bacteria to grow. So what are some of the symptoms of having cellulitis or skin infection? So the skin is going to be very red, swollen, painful, and very warm to touch. And you may also even have a fever and chills. As you can see, early and mild starts small, but it can spread out if you don't get it treated. So some of the useful tips to help prevent a skin infection or cellulitis. You want to keep the skin clean. Moisturizing skin is off with a good lotion to help prevent that drying and cracking that I had mentioned earlier. And now remember, we cannot do this ourselves, but we can tell our elderly to use the lotions and encourage them to put it on themselves. We cannot put it on for them. Avoid using very hot or very cold water, using somewhere in the middle, non-irritating. Stay hydrated. Remember, your skin gets drier, creates that opening for infection. So, True or false? Dry skin in elderly contributes to an increased risk of skin infections. This is true. Skin that is cold to touch is strongly suggestive of an infection. True or false? So when you touch that red area, you're suspecting it's a skin infection, it feels cold. True or false? False. Remember, it should be warm to touch. Keeping elderly skin clean and moisturized can help prevent skin infections. True or false? And this is true. So remember, although we cannot give moisturizers on the elderly patients themselves, we can tell them to put it on themselves, and keeping their skin clean. These are two things we can help prevent cellulitis from occurring. So in conclusion, I just want to go briefly a little bit over what we talked about today. So infections in the elderly are responsible for more than half of the deaths in long-term care facilities. Elderly people have multiple issues, and that plays a role as to why they're more susceptible to infections and dying from them. The chain of infection, we talked about how pathogens enter a host, spread to the surroundings and to the person through direct and indirect contact. We talked about how to break this spread, having high-end hygiene, which is very important. Masks and gloves are second ways we can stop this chain. Contact precautions, we talked about the different contact, droplet, and airborne precautions, what are different bugs that are out there, and when should we use gloves and gowns, and when should we use masks. We talked about protecting the elderly from infections by maintaining a clean environment around themselves, and also keeping them clean themselves, such as keeping good oral hygiene and regular bathing. And then we went over the three most common infections in the elderly: respiratory illnesses. We talked about the viral influenza and COVID. We even talked about the bacterial pneumococcal. We talked about urinary tract infections, which is broken up into bacteria in your bladder and bacteria in your kidney. And then we talked about cellulitis, which is a skin infection. And so that sums up my talk today. I hope everyone learned and benefited from my lecture series, and thank you all for your time and your attention.